In this section, we're going to talk about risks and complications of the weight loss surgery procedures that we just discussed. I personally would classify these complications and risks into two sections. Early complications typically happen within the first 90 days, and these are usually failure of proper healing process inside the body. Long-term complications typically result because of the change that we have made inside the body after the healing is complete. Early complications may include suture line failure with a leak at the gastric sleeve or gastric bypass, suture line or staple line causing internal infection that may need us to go back surgically and repair, and the potential risk of this complication is approximately 1% or less. Sometimes there may be excessive bleeding that would start after the surgery from the gastric sleeve or bypass suture lines, and usually this bleeding tends to stop by itself, and on a rare occasion we may be required to go back surgically and find the bleeder and fix it. Sometimes there may be excess scar tissue development as the patient heals, causing what we call stricture or tight spots in the gastric sleeve or gastric bypass, wherein patients may have more nausea, they're not able to advance their diet according to schedule, they may be having some difficulty keeping certain foods down, and in these types of patients we would go in endoscopically, use a balloon dilation method and stretch out these tight spots, and most often the patients respond very well for that. Rare medical complications may also include blood clots in the legs, pulmonary embolism, etc. Occasionally, with serious complications as such, even death in bariatric surgery is possible. Currently, the risk of death from bariatric surgery is anywhere between 0.2 to 0.5%. Long-term complications may include intestinal blockage or intestinal obstruction from scar tissue at the small intestine, and this may be particularly relevant in a gastric bypass or duodenal switch procedure. In a gastric sleeve, since we're not working on the intestines, it is unlikely to result in an intestinal obstruction. With the gastric band, the device itself may migrate into the stomach, and this is called a band erosion. Occasionally, we would see a gastric band slippage where the band gets out of position and slides down on the stomach, and rarely we see complications with the port and the tubing, where the tubing may crack or the port may leak the saline out. This is not a dangerous complication, but most of these device-related complications would need another surgery to repair or fix or remove the device.